Well, Buffalo Bills legend Jim Kelly will have surgery tomorrow for cancer in his jaw. Earlier this week, we learned the shocking news that he was suffering from squamous cell carcinoma. And as News 4's Dr. Peter Ostro tells us, while cancers in the mouth area are uncommon, they can be very dangerous, and early diagnosis is the key. Doctor?
That's right. As with almost all other cancers, the sooner we find a cancer in the oral cavity, the better the outcome is likely to be. And unlike most other dangerous tumors, we can see them developing.
A nice big old eye.
People tend to see dentists more often than physicians, and a dentist is more likely to discover a suspicious lesion in the mouth.
The physician is looking at your entire body, of which the oral cavity is going to be a small part. A dentist is really concentrating on the head and neck region in the oral cavity.
Dr. Hall is chairman of the Department of Oral and Maxillofacial Surgery at UB Dental School. He points out that early discovery really matters.
Cancers that are identified in the dental setting are of an earlier stage, a stage 1 or stage 2, than cancers when they are identified by the physician, which are often stage 3 and stage 4. And that means that they're harder to treat, they're farther along in the disease process, and survivability is less.
Oral cancers develop slowly. One of the first signs is a raised white patch like this. That could be due to something else.
Is the patient chewing on their cheek? Are they chewing on their lip? Do they have a habit that might be causing this white spot?
But here's one that was caused by chronic snuff use. The gum has receded, the root of the tooth is exposed, and the white spot has a corrugated appearance. That's precancerous. But even then, there may be no symptoms.
Later on in the process, it's typically associated with pain, or an even more ominous sign would be numbness.
A lesion like that should be biopsied. We can see the progression of changes under a microscope, and if a cancer is treated early, the 5-year survival is 90% or more. The treatment of oral cancers is similar to cancers elsewhere in the body. Surgery is primary, possibly combined with chemotherapy or radiation. The key is finding the lesion before it spreads.
Finding it early. Now, you said there can be no symptoms, but there can sometimes be some kind of a warning.
Some kind of a little, well, there might be. There might be. If you have a sore in your mouth that doesn't heal for a week or two, that should be examined. If you look closely at your own mouth, you might see a little patch that's white or red. Show that to your dentist or your doctor.
And the dentist is key here.
The dentists usually find them sooner. Yeah.
Okay. Thank you so much, doctor. We appreciate it.